Hi everybody, welcome to your Nursing Education Practicum course. Week 8, at the end of this week, we will be halfway through our course already. It's gone by quickly. All right, so this week we're really going to spend our time discussing development of curriculum, as we have been, but this time as it relates to an institution's mission and vision and also internal and external stakeholders. So if you click on the links that are provided either in the DQ or in the course materials, first there's a little video on the page. I think that'll help you to deal with this question. And then also under main campus, there's a link that says foundational documents. I think that'll help you. We've talked about this a little bit in one of our competencies, but now we're going to dig into it further. What I do want to spend the time on with this video is accreditation and external stakeholders. Kind of some areas that we need to consider when we're building curriculum, both for academia and for the clinical setting. So let's start with academia. The American Association of Colleges of Nursing has these things called essentials. BSN essentials, MSN essentials. The primary areas of focus that BSN prepared graduates should have this knowledge, okay? For instance, and I'm going to include a link to this, but the BSN essentials include information about a liberal education base, so all those gen ed courses, leadership quality and safety, evidence-based practice, information management and technology, healthcare policy, finance and regulatory environment, and interprofessional communication and collaboration. So these are things that have to kind of run through the whole program. So as we're looking at curriculum for a particular patient condition, topic area, course, we have to think about, okay, I've got all these things that we're being going to be evaluated on that have to be included. How am I including all of these threads across each of the curriculum areas? Then, if you're going to be accredited by that body, their accrediting arm is called the Commission on Collegiate Nursing Education. And I am including a link that talks about accreditation and preparing for accreditation and that sort of thing. And so that piece, part of it talks about curriculum, part of it includes things even like how is the organization set up? Does the parent organization provide enough funding and resources for the nursing program to run? There's a lot of things in there, but then there's a lot of curricular pieces also for the accreditation. So I'll include both of those links. And then for the hospitals or other healthcare institutions, a lot of them are accredited by Joint Commission. And so those standards, in addition to any specialty organization standards, are a lot of the things that we have to consider when we're dealing with clinical education. Now, I can't provide you with the Joint Commission standards because you have to pay for them. But if your facility is Joint Commission accredited, you can find those standards where you work, usually in the quality department. But I can provide you a link to the 2018 National Patient Safety Goals. And typically we are doing education every year about the National Patient Safety Goals. No huge changes for 2018 that I really see, but some of the areas of focus are things like alarm safety. We've been dealing for the past few years, maybe 5-6 years, with alarm safety. Setting our alarms correctly, who responds to them, how quickly do we respond to them, what's the appropriate criteria for using them, things like that. Assessing suicide risk, that's been an issue the past couple years, especially in there's mental health suicide assessment, but then in non-mental health settings, how do we really assess for risk of suicide? Using EBP, evidence-based practice to prevent infection. We've been doing a lot of work as far as central line infection and CAUTI and, preventing those infections. But there's been an increased focus now on resistant infections, antibiotic resistant infections, and how are we using evidence-based practice in treating them and managing them? How are we backing up our isolation policies? So those are some things that we're continually focusing on as another external constituent, the Joint Commission. So I just want to give you a few examples of some of the things that we need to consider in our curriculum besides the actual content that we want to teach. We have a lot of people that will tell us what we need to teach in addition to what we want to teach. So I'm including links to those 3 areas so you guys can see them. Looking forward to some good discussion this week. If you have any experience in your professional life or in your practicum with having to meet any outside stakeholders' requirements or internal stakeholder requirements regarding curriculum development, I would love to hear about that, and I'm sure the rest of the class would too. All right, everybody, I think that is about it for this week. We are in, let's see, week 8, so that means we're going to have another NEPD due. I am enjoying reading them immensely. I love hearing what you're doing in your practicum, and it might seem like just an exercise to you, but I really, it very much helps me keep up to date on how you're doing, and I'm really interested in the experiences that you have. All right, guys. Oh, one thing I wanted to let you know, I am leaving tomorrow morning to head out to Wisconsin. We have some family back there that we're going to visit. I'm very excited. We only get to see some of them once a year. And so you probably won't notice any difference at all. But just know that even the days that I'm not posting within the course, every day I will still always check the individual discussion forum and the questions to the instructor forum, and then get back to you as soon as I possibly can. But just wanted to let you know that. All right, see you in the main forum.